Good evening, everyone. My name is Yixiao, and I'm a second-year graduate student at Yale. So tonight, I want to share you about a really exciting new field of an aspect of personalized medicine called pharmacogenetics. So in essence, pharmacogenetics is giving the right drug to the right patient based on the genetic information of individual patients. Now, it is a rather unfortunate fact in medicine that a large proportion of patients do not respond to the prescriptions that they receive from their doctors after a proper diagnosis. According to the study done in 2001, 38% of the patients do not respond to the antidepressants that they get. And if you go down the list, 40% don't respond to asthma drugs, 43% doesn't respond to the diabetes drugs, and so on and so forth. And go to cancer drugs, 3 out of 4 patients do not respond to the cancer drugs that they get from their oncologists. So why is that? Why can't you have this cohort of patients receiving the kind of presenting with very, very similar clinical symptoms, present to their doctors who are very competent and giving to the best of the doctor's knowledge the best diagnosis that they can get, and receiving the same prescription yet having all sorts of different responses? From, in the best case, the drugs that they receive are not toxic and beneficial to the patients, and in the worst case, drugs are toxic and not at all beneficial to the patients. To some intermediate cases where it might be toxic but it's beneficial, but not toxic and not beneficial. So what's all this diversity coming from? And we know that both gene and environment plays a big role in individual patients' response to the medication. If I can just give a simple example, like Monica actually gave a very good example in her talk that one genetic aspect that might affect patients' response to drugs is the rate of which the drug is metabolized after the patient takes the drug. So it's easy to see that if a patient metabolizes chemicals, those particular chemicals that's used to make drugs at a faster rate, then they need a higher dose to achieve the same effect, vice versa. And we all know that environmental factors play a big role. For example, the patient's diet, exercise levels, and levels of emotional stress all plays a big role on how the drugs interact with the patient's system and bring out the desired changes. Now, clearly both gene and environment are important, but in the recent several decades, there has been tremendous amount of progress in understanding the biology of genetics. So that really opens up many, many exciting opportunities for us to get better handles on understanding how the genetic differences among individual patients affect their response to drugs and how to utilize that knowledge to optimize the way we prescribe drugs to different patients. So it is truly an exciting time in medicine that no longer do we have to give prescriptions solely based on the clinical manifestations. In this case, a mammogram used to help staging and giving proper diagnosis of breast cancer patients. And we can add, in addition to their clinical manifestations of the disease, add their genetic information of individual patients and help make a better diagnosis and help design better clinical courses. So next, I will use the example of Herceptin, which is a breast cancer drug, to illustrate the concept of pharmacogenetics and show you how pharmacogenetics is being incorporated into our everyday clinical care at the moment. Now, to help illustrate the point, let me ask you this question. You see those 2 pictures? Picture on the left, picture on the right. Can anyone tell me the difference between those 2 fires? Anything that you observe?
The left one is coal.
Oh, Monica. Clearly, that's not the most obvious thing that popped up. So yeah, we went through this talks quite a bit, and Monica knows the. So yeah, Monica's right. Yeah. On the left, you're seeing a pit of burning coal. On the right, it's basically a tank of oil that's on fire. And how would you put out a pit of burning coal? You can dump water on it and just extinguish the fire, right? And from daily experience, or from kind of, I hope not anyone's experience, we know that it's not a good idea to use water to extinguish a can of burning oil. What else? You see this. So that's totally not the effect that we're trying to get. We're trying to extinguish this fire. Now, managing cancer is, in many aspects, really similar to trying to put out a fire. And just like different types of fuel can be used to sustain a burning fire, cancer is actually caused by a multitude of different dysregulations on the molecular level and individually. Right. So shown here is a schematic of a cancer cell. So like any other cell in the body, the cell is constantly being bombarded by sort of 4 different categories of signals. There are molecular signals that tell the cell, okay, you should divide. And there are signals that tell the cell, no, you should not divide. And there are other signals telling the cell, you should live, you're doing well. And there are other signals telling the cell, no, you should die. So any cell in the body is kind of under constant flux of those 4 different categories of signals. And it's the proper balance of those that brings out normal physiology. So you can see that really misregulation of any one of those 4 categories of signals can precipitate cancer. Meaning that, because cancer is essentially uncontrolled division and proliferation of cells. So for example, you have an expansion of this signal. It disrupts the balance so that cells tend to divide more, and that facilitates cancer development. And here, if you don't have enough stop signals, tell the cell you should divide at a slower rate or not dividing at all, you're more likely to have cancer. And similar here, if there's more signal telling cells that usually should have died off to continue living, then it's clearly not a good thing. And similar here, for cells that should normally have died already to not die, and that would again be a precipitator of cancer. So because there's all those different molecular mechanisms that lead to cancer, ideally you would want to treat different cancer cases differently, targeting the fundamental reason why that cancer arises in the first place.